myeloma today represents a quite significant number of patients, and because of a significant improvement in the life expectancy of the patients, actually the prevalence of the disease is also increasing. Furthermore, myeloma is a disease of the elderly, with a median age at the time of diagnosis between 65 and 70 years. So we need to develop not only more active regimens, but also regimens that could be tolerated by patients who are in the late 70s and early 80s. Despite significant progress in the overall survival of the disease, still the majority of the patients continue to relapse, and eventually they become resistant to any kind of therapy. The main treatments of myeloma are based on proteasome inhibitors and immunomodulatory agents, but over the last few years there has been a significant interest in exploiting the role of immune therapies in the treatment of myeloma. And these are being done by the use of monoclonal antibodies. And here is an example of an immune therapy combined with immunomodulatory agents. So this SLAMF7, which is signaling lymphocyte activation molecule, factor 7, is located on the surface of myeloma cells, as you can see here, and also on the surface of natural killer cells. And this is important because if you administer the Elotuzumab, which is a monoclonal antibody specific for this SLAMF7, there is a dual mechanism of action. Thus, the Elotuzumab binds to the SLAMF7 on the surface of natural killer cell and activates it. So this is one method. And the other method is that it is bound on the surface of the myeloma cells, and it is flagging these myeloma cells to be bound by the natural killer cell. So you have not only binding by natural killer cell, but also binding by an activated natural killer cell. So we believe this is important as a mechanism of action which may also overcome resistance, which is known to be developed with monoclonal antibodies that have a different mechanism of action. So this prospective randomized trial, ELOCON-2, was conducted in multiple sites across 21 countries and compared the standard regimen, lenalidomide and dexamethasone, for patients with relapsed myeloma versus the investigational arm, which consisted of the same lenalidomide dexamethasone with the addition of the monoclonal antibody elotuzumab. So these were patients that had relapsed myeloma. They should have received at least one, but no more than 3 prior lines of therapy. And the treatment scheme is shown here. Lenalidomide and dexamethasone is being given orally, so it was given continuously in both arms, and in the investigational arm, elotuzumab was given intravenously, weekly at the beginning, and then after a few courses every 2 weeks, again continuously. These are the main findings of the study. The two co-primary endpoints were progression-free survival and response rate. And you can see that there is an improvement in the progression-free survival in favor of the arm of elotuzumab with lenalidomide dexamethasone. The best way to assess improvement of one regimen over the other regarding the progression-free survival is to use the hazard ratios. And you can see here that the hazard ratio is 0.7, indicating that when you administer the investigational arm, elotuzumab with lenalidomide and dexamethasone, you decrease by 30% the risk of progression or death in these patients with multiple myeloma. Another interesting observation with this trial is that there is a continuous improvement of progression-free survival, and actually you can see that the difference at 1 year is 11%, and then it gets to 14% at 2 years. Furthermore, these studies continue to be monitored for progression-free survival. Data are being collected prospectively to see whether with longer follow-up we may have a fraction of patients who will remain without progression for an extended period of time. Also, overall response rate was in favor of the combination of elotuzumab with lenalidomide and dexamethasone, and you can see here that there is a difference of about 13% in the response rate. So to conclude, elotuzumab is a novel first-in-class antibody that has a dual mode of action, tagging the myeloma cell and activating the immune function to enhance the efficacy. ELOCON-2 phase 3 trial represents the highest level of evidence for this novel target and agent in the treatment of relapsed and refractory myeloma. Patients who were treated with elotuzumab, with lenalidomide and dexamethasone had a higher response rate and longer progression-free survival. And of course, we are very eager to see what the effect on the overall survival of these patients will be. Based on earlier trials, the FDA has given elotuzumab breakthrough status for patients with myeloma who have received one or more previous therapy, and these data reinforce this decision, and it is expected that all these files will be submitted to regulatory authorities both in the United States and in Europe in order to obtain full approval of this combination and access to the patient.